As WIC employees, your dedicated service has helped numerous pregnant women, new mothers, and young children learn about nutrition and what they need to do to stay healthy. This invaluable program will continue to do so through your efforts to help those in need. Part of your efforts include upholding the federal requirement to provide all women with substance abuse information, including the harms of tobacco. The following presentation has been designed to assist you in meeting the federal requirement. To start, let's discuss why the federal requirement exists and why it falls to WIC to put it into action. The Surgeon General warns smoking is probably the most important preventable cause of poor pregnancy outcomes among women in the United States. In fact, if all pregnant women in the United States stopped smoking, there would be an estimated 10% reduction in infant deaths. And yet, women are still playing the odds. Smoking while pregnant affects nutrition and exposes the unborn baby to potential problems like low birth weight, premature birth, lung problems, and sudden infant death syndrome. And after birth, there is no safe level of secondhand smoke. The dangers are real and can even affect the nutritional uptake in children, especially depleting important antioxidants that are necessary for immune defense. That's why the federal requirement states that nutrition education will include information on drug abuse and other harmful substances, and participants shall be advised of the types of health services available, where they are located, how they may be obtained, and why they may be useful. By supplying women with the resources to quit smoking before, during, and after their pregnancy, you'll be supporting a healthier life for mother and child alike. So how does this work in a typical WIC office visit? Let's take a look. When a participant first visits a WIC office, they sign a rights and responsibilities form, giving permission to share their information with designated third parties. This includes the Utah Tobacco Quit Line. As policy, during the certification appointment, you'll ask if the participant or anyone in the household is currently smoking and if they are interested in receiving help in quitting or helping the person in their household quit. If they answer no, you will document this response in the participant's comment screen of the computer system. Then provide general education and distribute materials about the Utah Tobacco Quit Line. If they answer yes, the system will prompt you to print the Tobacco Quit Line referral form with the participant's consent. As we mentioned earlier, the participant has already signed a permission form and will not need to sign the referral form. This form then needs to be faxed to the Utah Quit Line within the same business day. Print and fax. It's just that easy and just that important. This form can also be found at any point during the process by clicking Report on the toolbar and selecting Utah Quit Line Referral Form from the drop-down menu. Also note that if the participant answers yes but refuses help, simply shred the referral form once printed. Now that we know the office procedures, what can you share with the participants about the Quit Line? Here are some of the basics. The Utah Tobacco Quit Line helps hundreds of Utahns every month to quit tobacco. It's a free and confidential service that allows people to develop a personalized quit plan with help from experts.
When somebody calls the Quit Line, we recognize that they're taking an enormous step to make a change in their life. And we take a step-by-step practical approach so that the person, by the time the call ends, has a plan and knows what they're going to do next to achieve their goal.
The Quit Line offers additional counseling sessions for pregnant women, free nicotine replacement therapy, and more.
It's confidential and we know what you're going through. We know what kind of courage it takes to give us a call, and we're here to help.
It's a free phone call and service, whether callers are insured or not, and it's confidential, just between the caller and the quitting coach.
WIC's primary focus is nutrition. However, that's only one facet to an individual's health. And so we want to also focus on other health factors that play out in their lives, one of which is tobacco cessation.
I wanted to quit smoking because I wanted my children to be in a smoke-free environment. The staff on the quit line were really friendly. They helped me with every step with quitting. They were really awesome. If I knew somebody that was smoking and pregnant, I would definitely refer them to the quit line. I've been smoke-free for 2 months now, and I feel great.
Working with the participant to have a smoke-free pregnancy, to have a smoke-free household, not only improves the life of the mother, but also the children and any infant that might come into that household.
And I think that's where we can come in and give them a little bit extra education about the benefits of the tobacco quit line, that they can meet with somebody or talk to somebody that can maybe provide some extra techniques or strategies to help them, push them along to quit altogether.
I just want everybody to know and catch the enthusiasm of what it's like to have a mom that's come into the clinic who has quit smoking during her pregnancy and continue on the postnatal period when that baby is breastfeeding, when the baby starts to crawl, walk. We want to continue with her, non-smoking behavior because it makes for just a better, healthy outcome for everyone.
I'd like to thank the WIC staff across Utah for the dedicated services that they provide to WIC participants every single day. We work in a very busy environment. We've increased our participation by more than 10,000 in the past 15 months. And so when people walk in for services today and they're still receiving great services and referrals to other programs that help improve their lives, what a remarkable thing. And so I thank the staff for their dedication in helping Utahns be as healthy as they can be.
Both WIC and the Utah Tobacco Quit Line share a common goal: to help individuals become healthier for themselves as well as their children. Thank you for your efforts and dedication.